many of our patients, we are their only source of healthcare.
Why do you think it's reproductive health that regulators try to restrict access to?
Ultimately, it has a lot to do with power.
Hello and welcome to the Contrary. I'm Bonnie Urbay. This week we continue our Women Thought Leader series with Dr. Leana Wen, the new president of Planned Parenthood. She is the first physician to lead the organization in nearly 50 years and a whole bunch of other firsts, including, how you came to the job, where you came from, where your family is from. Tell me about all that.
Bonnie, thank you for having me here, and what an honor it is to be working now as the head of Planned Parenthood, which is an organization that's meant so much to me throughout my life. When my family and I first immigrated to this country, my mother was a patient of Planned Parenthood, I was a patient of Planned Parenthood, my sister was a patient of Planned Parenthood, just like 1 in 5 women in America. I always knew Planned Parenthood as a place that we could come to for compassionate and judgment-free healthcare and education. So I'm really honored to be leading this organization that's done more for women's health than any other. And I come to this as a physician because I've seen what's at stake when people don't have access to healthcare. And I've also seen what happens when specifically reproductive healthcare and women's healthcare is treated differently than every other aspect of healthcare. That's what I'm here to change, to talk about how all aspects of healthcare is healthcare.
When you say you and your sister and your mother both were patients at Planned Parenthood, I'm just curious. I remember doing stories years ago. I was in actually Morocco, where USAID was funding family planning, and in truth, the family planning clinic was really the only medical clinic within hundreds and hundreds of miles, and the women, some of whom were pregnant, most of whom did not appear to be pregnant, but had at least one child on each hand, or maybe one also that they were holding, would come for pediatric care. And because they were poor, they had no money, this was the only place they could get medical attention of any kind. Is that true at clinics, Planned Parenthood clinics in the U.S.?
Planned Parenthood has over 600 health centers around the country. And for many of our patients, we are their only source of healthcare. And I think it's important for us to talk about what are the services that we provide at Planned Parenthood, that we are very proud to provide at Planned Parenthood. We provide a full spectrum of reproductive health care. We provide cancer screenings, breast and cervical cancer screenings. We provide STI and HIV tests. We provide vaccinations. We do well woman exams. We care for LGBTQ and trans patients. And we provide the full range of reproductive health care, birth control, contraception, and the right to safe legal abortions, all of which is healthcare. And for so many of our patients, this is the only place that they get healthcare. We see directly what happens when politicians try to limit people's access to that care. In Iowa, after 4 of our health centers were forced to close, we saw STD rates skyrocket. In Texas, the state's own data show that 30,000 fewer women accessed any type of service, any type of healthcare service, after our health centers closed. Over 90% of the work that Planned Parenthood does and that Planned Parenthood provides is preventive. And I think it's important for us to understand that when politicians try to limit the ability of people to access care at Planned Parenthood, they're limiting people's right to fundamental health care. And it's blatantly discriminatory because wealthy people of privilege have always been able to get the care that they need. So when we try to impose barriers on care, on reproductive care, on all types of care, those who are hurt the most are those who already bear the brunt of inequities and disparities. And it's people of color, it's people with low income, it's immigrants, it's LGBTQ people. And we in Planned Parenthood are proud to serve everyone, no matter what they look like, where they come from, what their income, no matter what.
Do you think that the people who are solidly anti-abortion care that it's low-income women? Is that an argument who are hurt when not just abortion rights, but reproductive health care rights are barred by a state law? Do they care if they're hurting poor women? Do they care if they're hurting women of color?
Look, I come to this work as a physician, and this is my understanding as a doctor. My understanding is that my job is to provide all the information, education, and services that my patients need in order to make the best decision for themselves and for their health. I trust my patients. I trust women. That's what it's all about.
Why do you think it's reproductive health that has been, the only area of health that regulators try to restrict access to?
So I've seen how reproductive health care, women's health care is just stigmatized and siloed out in a way that we don't do for any other aspect of healthcare. I remember in medical school, I lived near a Planned Parenthood in St. Louis, and I would go to my clinical rotations and see people going in and out of Barnes-Jewish Hospital and Children's Hospital, doctors, nurses, social workers, patients, and they would just walk in and out of the hospital because they're getting health care. Then I would pass the Planned Parenthood and see protesters outside waving signs, shouting often obscenities, and think about, why is this so different? Why are our patients and doctors and nurses, why do they have to go through all of this in order to provide life-saving care, in order to receive life-sustaining, life-transforming care? This is all healthcare. Ultimately, it has a lot to do with power, because for as long as civilization has existed, there have been people who have tried to restrict women's ability and our power. And
to make decisions about their own bodies.
That's right. That's right. And this control and this power over our reproductive rights and over our bodily autonomy. I mean, how can women truly be equal if we don't have something as basic as bodily autonomy?
Right to lifers say it's not just their own body, that there's another, I don't know what they would call it, but another human being, even if just at the point of conception, involved. What do you say back to them?
Well, first of all, I contest the language that is being used. Both the terms pro-choice and pro-life, I contest. Pro-choice, I contest because that's assuming that everybody has that choice, when actually choice is predicated on privilege. Wealthy white people may have that privilege, but for so many of our patients, they already don't have that choice and already live in a world where Roe versus Wade doesn't apply to them. If you can't literally access health care, then you don't have the choice to that care. So that's the problem.
The states like Texas, with some Indiana, like Midwestern, Southern Bible Belt states where, there are waiting periods, there are some in the courts it's being fought over, hospital regulations being imposed on Planned Parenthood clinics. Is that what you're talking about, women in those states?
In the last 7 years, there have been over 400 restrictions passed that directly limit women's ability to receive an abortion or that directly affect their reproductive rights in some way. In 7 states around the country, there is only one abortion provider left. For so many women in this country, they're already living in a post-Roe world. And so that's why I contest choice. I also really contest the term of pro-life. I'm a physician. I went to medical school. I became a doctor to save lives. Working in the ER, I'm an emergency physician, I save lives all the time, in every shift, every day. And what we do in Planned Parenthood is to provide life, to provide opportunity. Being pro-women is being pro-family, is being pro-community, is being pro-economic justice. And it's important that we reclaim this language of we are pro-women, pro-choice, pro-reproductive health. We are pro-life as well, because this is about the life of all the people, all the patients that we treat.
The media, people just talking in conversation, they always want to use one short phrase to say very succinctly what it meant to be in favor of abortion rights or opposed to abortion rights. What terms would you use instead?
I would use pro-reproductive health, pro-women's health, because that more accurately describes what it is that we are aiming for. And I want to say that just it's so important to emphasize why abortion is healthcare, that reproductive healthcare is healthcare, and that we must understand all aspects of healthcare to be a fundamental human right. That's my job as a doctor.
And what would you call the forces who oppose women having these rights?
I would say they're anti-reproductive health and anti-women's health, because that is the direct consequence. I mean, working in the ER, I remember treating a woman who waited more than a year before she got a lump in her breast examined. She didn't have access to health insurance, didn't have access to health care. And by the time that she came in, we diagnosed her with, by then, metastatic cancer that had spread throughout her body. And not long after I saw her, she died. And she left behind 3 young children. That's what happens when women don't have access to health care. That's what happens when we treat one aspect of healthcare so differently than any other. I mean, the Trump administration has been proposing their Title X gag rule, and the gag rule is something that would forbid doctors and nurses to say anything to our patients about abortion, even if they're asking for it. For what other aspect of medicine is this even remotely acceptable? And I think we need to call out the injustice of it, and also specifically tie that to the systemic oppression and injustice that's been happening to women, that's been happening to people of color, that's been happening to immigrants. My family, when we first came to this country, we depended on Medicaid, we depended on food stamps. When my mother was pregnant with my little sister, she used WIC for healthcare, for nutrition services. These are legal public benefits. And for us, they were our lifeline.
And what's the Trump administration doing to them?
The public charge rule, which the Trump administration has proposed, basically says that if immigrants use these public benefits, that they could be left out when it comes to green cards or the ability to stay in this country. And just the idea of making people choose between staying healthy or staying together as a family is just unconscionable. I mean, I'm a new mom. Maybe I should stop saying that. My son is now 15 months old, but he's still my baby. But I mean, I can't imagine what kind of decision I would be forced to make if it were between what happens if my son is sick now. Do I take him to the hospital now with his asthma attack? Or do I keep him at home, because if I took him to the hospital, it might mean that we can't stay in this country.
Interesting. You're changing an awful lot of things.
There is huge unmet need in this country for healthcare. It doesn't make sense that the U.S. is the only industrialized country where the rate of women dying in childbirth is increasing. It's higher now than it was in 1990. I mean, how does this make sense? An African-American woman is nearly 4 times more likely to die in childbirth than a white woman. African-American women have a 40% higher chance of dying from breast cancer than white women. Women are basically canaries in a coal mine, or pregnant women are, that we're seeing the rate of maternal mortality increasing because women's health is not being attended to. There are huge gaps in access, and it's all across this country. Yes, we need to be expanding abortion access in places where it may be basically out of touch or unavailable for so many women. In this year or this coming year, we may face a situation where Roe versus Wade could be overturned or further eroded with this new Supreme Court with Brett Kavanaugh on it. And if that's the case, 1 in 3 women of reproductive age, which is 25 million women, could be living in states where abortion is outlawed, banned, and criminalized. I mean, we need to be expanding access to abortion access and reproductive health access, because we know that we are nowhere close to what is appropriate to have health equity in this country. But there is also so much more that we have to do when it comes to improving health, providing health care, and reducing these disparities that really are unjust and are taking us away from where we ought to be as a country.
Tell me the states where it's functionally impossible for women to get abortions.
There are huge swaths in the Midwest, in the South, where women face so many restrictions. And I'll give you one example of this. I had the opportunity recently to visit one of our affiliates that provides care in Minnesota that also covers a large area, including North Dakota, South Dakota, and some other of our Midwestern states. And I heard from one of our state directors who works in South Dakota, who was saying that in their one clinic, the one Planned Parenthood clinic in South Dakota, that because of the 72-hour waiting period law, that by the way is not based on any kind of science or medicine or any data, but because of that law and because of the fact that there isn't the Planned Parenthood doctor doesn't live in South Dakota. This person flies in, the doctor flies in from Minnesota on a Monday to see patients. The patient has to drive potentially hundreds of miles, hours, to come and see this doctor at the appointed time. And then who knows what else she had to do to make that happen, take time off from work or get childcare and pay for transportation. And then that woman, because of the waiting period, the forced waiting period, has to come back in 72 hours and see the same doctor. And if she couldn't find childcare or transportation, or if that doctor didn't make her flight, the patient would have to do everything all over again the following week, the following Monday, and then the following Thursday. And by then it may well be too late because of the time that may have passed. I mean, this is what women have to be going through around the country already. And not to mention that if rights are further restricted, we may face a situation where more than 20 states could have no abortion access whatsoever. And I think about the terrifying time that is for women across this country. And this is why I believe that the single biggest public health catastrophe of our time is the threat to women's health.
The pharmaceutical abortions, RU 486 and Plan B, has that alleviated the burden at all in, for example, states where a woman cannot go into a clinic because it's hundreds of miles away or it doesn't exist? But she can go online and buy or to her local drugstore, if the state hasn't banned it, over-the-counter abortifacients. Has that eased your burden at all, or no?
I don't think that is the reason why we are seeing for example, the CDC just issued a report showing that we are at an all-time low for teen birth rates, for unintended pregnancies. I believe we're at a 30-year low. We also are seeing abortion numbers total in decline. The reason we're seeing that is birth control. The reason we're seeing that is we have access to comprehensive sex education, that we have access to birth control. It's no coincidence that the Affordable Care Act has, the way that it got passed, allowed women to have access to no copay birth control, which has saved women billions of dollars. I mean, we actually know what works. I mean, I'm a doctor and scientist, and I have to go back to the science and the evidence. And the science and evidence are unequivocal that what's resulted, why we have a record low of unintended pregnancies and teen pregnancies is that we have birth control. But I am worried that we're going to go backwards. I mean, less than 24 hours after the American people in the midterm elections voted in a pro-reproductive health majority in the House of Representatives, the Trump administration finalized a rule that would allow employers to deny women birth control, which is something that 9 in 10 women will use in our lifetimes. When
98% of Catholic women use birth control other than what's called natural birth control in their lifetimes.
And yet we're seeing these methods that are evidence-based be continually attacked and rolled back. When I was the health commissioner in Baltimore City, I ran a program. I worked with our partners to provide comprehensive sex education in our middle schools and high schools. Well, the Trump administration cut that funding. without any reasoning in a shocking and unprecedented decision. And so we sued them and we won. And that allows the young people in Baltimore to get access to education again. I mean, programs like that helped us in Baltimore achieve a 61% drop in teen birth rates in just 15 years. I mean, these are the things that have worked. And instead of rolling back the progress that we've been making, we should be investing more in prevention. And actually, that's what Planned Parenthood does. We do more to prevent unintended pregnancies than any other. So if that's our goal, we should be investing in Planned Parenthood.
Have pharmaceutical or chemical abortions, RU486, Plan B, have those changed the women's rights, women's medical rights debate, do you think? Because there are now, hundreds of thousands of women having non-surgical abortions. Has that whole evolution of a certain part of pharmaceutical medical care, has that changed the debate at all?
Having additional options has changed health care. But just as quickly as we have changed health care, we've seen politicians attack yet another safe aspect of health care. Abortion is one of the safest medical procedures. The CDC has it as a safety profile of over 99%. I mean, it is one of the safest medical procedures. And I also think it's important for us to talk about it as a procedure. It's not surgery, it's a procedure.
Right.
And so I think sometimes when we talk about medication abortions or surgical abortions, the term implies that it's a big surgery when in fact it's a procedure. And medication abortions also are extremely safe and are part of standard medical care. But the problem is that just as soon as we have these medical services available, politicians have come to restrict abortions and abortion care throughout the country. Many states have laws passed for physician-only, that are called these physician-only laws. It doesn't make sense. I mean, I work in the ER alongside physician assistants, nurse practitioners who perform highly complex procedures, who are administering medications that have far more side effects than medication abortion. So this is another example of us targeting one specific element.
You're talking about states like California that allow for, I believe it's nurses, some type of nurse or physician assistants to perform abortions.
Correct, and it does not make sense to choose to have one type of medicine and one type of healthcare be treated so differently than any other. I mean, there are laws passed around telemedicine. I mean, telemedicine is important as one way of getting people care where they are. And there are many states that have passed laws specifically restricting women's access to abortion and other reproductive health services by telemedicine.
That's the only area?
That's the only area, while they're in the process also promoting telemedicine for all other aspects of healthcare. So why are we restricting this one thing? It's just one more example and one more reason why I feel so passionate. That's what Planned Parenthood does. We are providing healthcare through our over 600 health centers to nearly 2.5 million people across this country, while at the same time fighting with everything that we have in the courts, in the states, in the federal government against this administration and any of those who would try to restrict people's ability to access the fundamental right to health care.
There have been OB-GYNs who've been murdered by anti-abortion gunmen, individuals who took it upon themselves to murder doctors or attack clinics because they're opposed to abortion rights. Are you safe in your job?
Ultimately for me it came down to, but what does it mean for our patients? What does it mean for our providers, our doctors, our nurses, our advanced practice clinicians, our social workers, our staff who get up every single day to walk through the doors of their clinics to serve people? I mean, they receive death threats, they receive bomb threats, they've been through attacks and people who, again, purport to be pro-life, but are attacking and threatening and ending lives. And I also think about what women and patients across the country have to go through in order to get care.
Dr. Wen, thank you so much for your time, and we wish you Godspeed as you move Planned Parenthood forward. Thank you. That's it for this edition. Please follow me on Twitter and visit our website, pbs.org/to the contrary. And whether you agree or think to the contrary, see you next week.